NHI is not even here, but the African National Congress government is already having problems with the doctors in the country. Man, as we speak today, we have hundreds and hundreds of doctors in South Africa, qualified doctors. These people are sitting at home unemployed. These people are sitting at home unemployed. Who would have thought, guys? Who would have thought that one day South Africa, we would be in a situation where we have unemployed doctors in the country? This is how bad things are. And the same people who cannot even find placement for these medical doctors are now going around telling you that they can manage national health insurance. They can manage national health insurance. And whoever talks bad about the African National Congress or whoever criticizes the NHI practically doesn't want the poor black South Africans to have the quality of health care that the people who are rich are having in this country. And you know how gullible South Africans are, and the fact that the majority of South Africans are not educated. These people that are simply been told that, guys, you know, once we kick off with the NHI, you will simply need a government card and everything is under our control. No one is talking about the tax. No one is talking about the fact that the taxpayers of this country that are already overburdened, man, they're going to be killed with this whole thing of the NHI. They are not saying anything about that. And I don't know why the people, man, within our communities, man, you know, I am so disappointed in black people, man, especially when it comes to these elections. I thought that in 2024, people would say, guys, it is enough. It is enough for your lies. I thought this is what people would say, but no, it seems like people are okay with the cadres lying to them time and time again. You know, when the ANC comes out and says that, guys, we can manage something like the NHI, you just need to look at the state-owned entities. You just need to look at their government and see their track record and say, man, these people have never managed something successful. There is not a single SOE that the cadres have managed successfully. There is not a single department that the cadres have managed successfully. So what makes people think that suddenly the cadres can manage NHI successfully? I don't know, man. I don't know. I mean, it is shameful, man. It is shameful to think that South Africa needs more doctors. It is shameful to think that South Africa needs more doctors. We need more nurses. People are going to school to study these things and they cannot even find placements. And these things are happening under the ANC government. And the same people who are telling you that they don't have enough money to hire these people are telling you they can manage NHI. They're telling you that you can manage NHI. I mean, like, I don't know why is it so. I don't know why is it our people so gullible, man. I don't know why our people are so lied to easily like this. I don't know why our people simply don't say, man, you say you can manage NHI. What have you managed successfully? Can you name one department that the ANC government has run successfully? Can you name one state-owned entity that the ANC government has run successfully? There is not a single department, there is not a single SOE that the ANC government has managed successfully, but the same people are going around saying that they can manage NHI. Guys, I think we need to raise our voices when it comes to the NHI. You remember last time during the State of the Nation address, President Ramaphosa said that President Ramaphosa practically is flirting with the idea of signing NHI. And I think Ramaphosa is going to sign that NHI bill before the elections. And this is going to be the biggest mistake that South Africans are going to allow to happen. If Ramaphosa actually signs that NHI bill, this is going to be the biggest mistake that South Africans are going to allow to happen. And I don't think South Africans on the ground, they are going to feel the pain of it until the bill is signed. You know, South Africans, they don't care about the country. They don't care about the direction of the country. They don't care about where the country is going, basically. So they're going to have to see the doctors within their communities closing shops before they say, guys, this whole NHI thing is nonsense. Medical practitioners in South Africa are saying, man, we are not going to stay for the NHI. No one is saying we are not going to stay for the NHI. And not because NHI is a terrible policy. I think NHI, it is something that needs to be discussed by people who know what they are talking about. NHI, it is something that needs to be debated by people who are qualified to talk about these things. I don't think the cadres, the ANC cadres, who don't have any qualifications, have any standing to talk about the NHI. I don't think the African National Congress has any standing to talk about the NHI. These people are simply going around and pretending like the NHI, it is something so small, man. We can manage it so easily, man. We can manage it so easily. So if the NHI, it is something that the comrades can manage so easily, why haven't they managed our healthcare system? Why haven't they managed our healthcare system? You know, this whole topic of NHI, man, it frustrates me. It frustrates me, man. And the fact that we see the doctors sitting at home, unemployed, it frustrates me more. That how can these people, man, who cannot even find money to hire the doctors that are sitting at home, how can they go around and talking about the national health insurance? It doesn't make sense to me. It doesn't make sense to me.
Let's get into another important conversation now. Unemployed doctors in KwaZulu-Natal say there should be no budget cuts for the healthcare system and that an additional budget must be sought to hire the over 800 doctors who are sitting at home right now without jobs. This is nationwide. The doctors marched today to the KZN Department of Health. This is to hand over their grievances. Let's get reaction now, and we're joined by Dr. Mvuyisi Mzukwa. He's from the South African Medical Association.
I mean, like, it is shameful. The doctors were not even supposed to do this. The doctors were not even supposed to embark on this on this protest. The doctors were not even supposed to be put on this position. Everyone knows how important it is for us to have doctors. Everyone knows how important it is for South Africans to have sufficient doctors. The doctors were never supposed to be on this position. And the fact that these people are on this position, it says everything that you need to know about the ANC government. The fact that you have unemployed medical doctors sitting at home, it tells you everything that you need to know about the ANC.
Association, the chairperson there. Dr. Mzukwa, thank you very much for your time. So 200 doctors marching today in KZN, and already there are flyers suggesting that tomorrow, this will be Tuesday, there will be doctors in the Eastern Cape who will join the picket line. Is this matter getting the desired attention, do you think?
Good evening to you, Polly, and to your viewers, and really thank you for inviting me to your program. Polly, the South African Medical Association supports the plight of unemployed doctors. And as you know, we are, doing work, we're hard at work, assisting wherever we can, to make sure that these doctors don't stay at home, because we know that, for example, there's been a recent report, I think recently, by the World Health Organization. You will recall that all of us are talking about universal health coverage, but in South Africa we call it NHI. So if you look at that, you notice that according to the WHO report, it says that the world is off track, with that significant with significant progress, towards this universal health coverage. In other words, we're steps away, far away from this Vision 2030, and we know that
And I'm sorry for interrupting the gentleman. Guys, don't you find it strange that the people who talk about the Vision 2030, these comrades who are talking about the Vision 2050s, most of them, they will not even be here to see the consequences of their actions. Why are South Africans, especially young people in this country, man? I have a huge grudge when it comes to young people in this country, man. Why are young people in this country sitting back and are allowing all the comrades to talk about the Vision 2050s, 2060s? Most of these people will never be here, won't be here to see this nonsense of theirs. Most of them, they will never be here to see this nonsense of theirs. So why are South Africans allowing these old politicians to talk about the Vision 2060, Vision 2070? They know that most of them, they will not be here to see the consequences of their actions. They will not be here.
Well, steps away, far away from, this Vision 2030. And we know that the World Health Organization has further suggested that to build back better, we need to reorientate our health systems, using the primary healthcare approach, because about 90% of, the essential universal coverage interventions can be delivered through PHC. And we know that these doctors were going to assist a great deal in this regard, because we know that the delivery of these services would require, healthcare workers, obviously, with optimal skills, obviously, at all levels, a skills mix, and also distributed equitably, urban areas versus rural areas. But also they must be adequately supported with access to quality assured products, and enjoying a decent work. Now, in South Africa, there is a dire shortage of these doctors. Yeah. You will know that in South Africa, one doctor is looking after 3,000 patients or citizens, if I may put it so. So that is not what we think we should be doing as a country, when actually we are touting NHI, we're telling people that we're working towards the NHI. Hence, some are saying we think that, the country is not ready to accommodate NHI. And hence, we have...
The comrades are not ready to accommodate NHI, man. The comrades are not ready to accommodate NHI. I don't think South Africa should be talking about NHI at this moment. I think South Africans, and South Africa as a whole, we should be talking about how we are going to fix the mess of the African National Congress, especially when it comes to the healthcare. We need to talk about how the public hospitals are going to be improved. We need to talk about how the public clinics are going to be improved. We need to talk about the technology that we are going to use to make sure that these institutions are improved. To talk about NHI, man, it is completely nonsense. It is completely nonsense, man. Just go to the public hospitals. People are dying, man, waiting for the doctors. The fact that today you have hundreds and hundreds of doctors in the country that are unemployed, go to the public hospitals. The people are dying, waiting for the doctors, man. One doctor has to attend to how many people? Hundreds per night. And this is what is happening. And the same comrades that cannot hire the doctors so that our public hospitals can be sufficient are talking about NHI. They're talking about NHI, man, and these people that are simply ignoring all these issues that are facing them right now, all of these immediate issues that are facing them right now when it comes to the healthcare. But no, they want to talk about NHI. They want to talk about the pie in the sky. They want to talk about the pie in the sky. Right now we should be having conversations about how we are going to improve the services with the technology. These are kind of conversations that we need to be having in South Africa. We should be talking about how we are actually going to help the people, especially in the public clinics. Many people in the public clinics, they stand in line the whole day. People go to the clinics with their children. They stand in the line of the whole day. I live near to the clinic, guys. Where I live is 10 minutes to the clinic. I know what I'm talking about. And people who live in the townships, they will tell you that, man, what is happening in the clinics, man, it is shameful. It is shameful. So why are these people talking about NHI? Why are these people talking about NHI? And why do they keep insisting on this NHI thing when we have so many problems that are facing us immediately? Right now, they have to attend to this thing of the doctors that are sitting at home. They were not going to talk about these doctors that are sitting at home. If these doctors didn't one day decide to wake up and protest, they were not going to talk about them. They were simply going to continue talking about NHI and pretending like everything is okay. You remember President Ramaphosa told you on the State of the Nation address that, man, our public hospitals are 100% are working so nice. This is what the president said. So the African National Congress was going to ignore these doctors. These doctors were going to be ignored if these doctors didn't stand up and actually say, guys, how is it possible for us to go to the medical schools only for us to sit down? They were going to be ignored. No one was going to pay attention to these people, man.
As Sama organize a conference from Thursday this week, where we're putting our minds together, from all stakeholders to say, how do we strengthen the healthcare system in South Africa?
Yes.
Dr. Mzukwa, do you accept the argument that was put up by the Health Minister, Dr. Joe Phaahla, who said provinces are unable to create vacancies or posts for these doctors because medical officers' salaries are expensive or they are high by their very nature. But he hastened to say that they are working with provinces to make sure that these doctors are placed in the public health care sector. Do you accept that argument?
Before we talk about these people costing a lot of money, why don't the government say, guys, there's a lot of us in the cabinet, why don't we trim down the cabinet? Why don't we trim down the cabinet? Why don't we do? But these people, man, are stealing the billions and billions of South Africa. These are the same cadres that have been accused of stealing billions and billions in this country. The same people are telling you that medical doctors are costing a lot. These are the same people that have been accused, man, of stealing a lot of money. I mean, like, you guys remember what the DA right now has just accused Paul Mashatile of? I was watching that video of John Steenhuisen talking about what they are accusing Paul Mashatile of. These people in government, man, it is fine. If their lives are okay, they're okay. They don't care about the people on the ground. They don't care about the medical professions. They don't care about the professionals in this country. As long as their lives are okay, they are okay. No one is talking about let's trim down. No one is talking about let's get rid of these deputies in the government departments that are useless. No one is talking about these things. How about we start saving money by getting rid of these useless MMCs? How about we start saving money by getting rid of these useless deputies all over in the government departments? No one is saying that. No one is saying that. You know why? Because these people, they don't want this thing to start affecting them personally. They don't want this thing to start affecting them personally. So it is easier for them to say that these people are costing too much, so we are not going to hire them. Yeah, we can go around and drive in our 5 million rand cars. It is fine for us to drive around in our multi-million rand cars, but we cannot hire these people because these people are costing too much. It is easy for them to make that excuse.
Let me dispute that with the contempt it deserves, colleague, because Sama has done a study, that shows that public health doctors, in fact, are underpaid. They are getting a salary that they were supposed to get in 2015. So to come up and say that they are spending lots of money on salaries for doctors, South African doctors are underpaid. We have a study to show that. Secondly, they are only talking about overtime. South African doctors have to make up salaries because of overtime. If you take away that overtime, there is absolutely nothing. They are earning peanuts, but they are working hard. The work environment is not so decent. It's not decent, to be honest with you.
It is not decent. It is not decent. It is not decent. Guys, at the state of our public hospitals, it is not decent.
And also there's security issues. And hence you see some of these colleagues leaving away because you've got broken machinery, you've got all these things. You cannot support healthcare workers. Even during the times of COVID, we had, a rhetoric from the minister saying that these are heroes and heroines. I mean, how do you become a hero when you are not supported? How do you become a hero when you suffer from mental illness because of the system that you are working in? So I don't believe that the minister was telling the truth to the nation. Actually, they are owing South African doctors. They should be paying them more.
But they are not going to do that, man. They are not going to do that. They are not going to do that, man. This is the classic the African National Congress. Guys, we've been speaking about this for a couple of days now. This is classic African National Congress, man. No one is taking accountability for anything. This is classic African National Congress.
Let's talk about his deputy, because he was the one, I think, that received the memorandum down in KZN, and he said words to the effect that this matter will be discussed and possibly dealt with during the SONA debate, which is going to begin tomorrow. Was that something that you take seriously, that a matter as difficult as this one can possibly be dealt with in a SONA debate?
Well, they become emotional when they tell them that they are telling the public, nothing. You'll recall that the minister was on air, called the media houses and had a media briefing. And I was expecting the minister to tell the South Africans that there's a plan in place. They've already spoken to provinces. They are creating those posts. But also they've already approached Treasury, and this is the response from Treasury. But no, the response was that we are still going to talk to the provinces. We are still going to approach Treasury. And the same thing, I mean, what is a debate?
I mean, like, it's an insult to say that that matter will be discussed in a SONA debate. It is an insult. Guys, everyone knows that there is nothing that we're going to get from the parliament. You know that in those SONA debates, when people will be hailing insults, people will be screaming at each other, honorable member this, honorable member that. And for him to say that issue is going to be discussed in a SONA debate, it's an insult to the people who went out to protest. It's an insult, and it simply shows that these people are not serious about discussing this issue that is affecting South Africans right now. They are not serious about talking about this issue that is affecting South Africans, man. To say that issue will be discussed in a SONA debate, it's an insult, because there is nothing that South Africans are going to get from the SONA debate. Ramaphosa will be there. The Speaker of the House will be there, shielding Ramaphosa from any responsibility, stopping people from asking questions, throwing people out of parliament, people insulting each other. This is what normally happens when these political parties meet in parliament. And for you to say that that matter will be discussed in a SONA debate, it simply shows that these people are not serious about this issue that is facing the unemployed doctors. They're not serious about this issue that is facing unemployed doctors.
Treasury. And the same thing, I mean, what is a debate?
Come on.
You can't be promising talks out of a debate of a SONA. I don't think that was a very intelligent response from the minister to the deputy minister. It shows how they are just not in touch with what is happening on the ground.
Exactly.
Because if you look on the ground, things are dire. You look at litigations, they are sitting at 120 billion and still counting. And it's because there's shortages, there's broken machinery, the system is in a crisis. But they will not agree to that because they think that we are an opposition party when we tell them the truth, that our communities on the ground are suffering. The stories that are out there in the media that shows that we are not giving the necessary quality services that our communities deserve.
Final question.
And of course, they see you as an opposition party. This is like the African National Congress, everyone who tells them that, guys, this is what is happening on the ground. They see you as an opposition party. They see you an opposition party, man. How can these people, man, insist that things are okay on the ground? How can they sit there and insist that things are okay on the ground, despite them being told that, guys, nothing is working on the ground? Why don't these people, man, just dedicate 1 week and tour the public hospitals in South Africa? Just dedicate 1 week and tour public hospitals and tour public clinics to see the state of those institutions. For them to stay there in the air-conditioned offices and to keep on saying that the things are working on the ground, and whoever opposes the African National Congress, whoever opposes us, is an opposition party. Man, of course, they see you like an opposition party. They see you like an opposition party. The African National Congress sees the people of this country as the opposition party. Whenever the people of this country tells them that, guys, this is what is happening, the president will be out saying, no, this is not what is happening. That's why the president had the audacity to stand in front of everyone else and told South Africans that the public hospitals are working. That's why the president had the audacity to tell South Africans that the public hospitals are working. That's why he had the audacity, man.
Question to you, Dr. Mzukwa. This is something that I think was observed by the health minister himself when he was, I think, responding to questions from journalists, where he made a statement that says this is actually a paradox. It's a contradiction in terms, because the health department in just one province was faced with medical negligence claims amounting to some 900 million rand. And he says that that amount of money could actually be used to pay the doctors, the very people who can help prevent these medical negligent claims. Is this something that you think they are now alive to, that these doctors must be absorbed because they are going to help reduce these medical negligence claims? But someone else could actually come back and say, but in the very same public health institutions where there are these claims, surely those are doctors who qualified in the very same institutions that the doctors who are unemployed right now came from. Did you get my argument here?
Look, It is indeed our plea to the minister to say you must employ these doctors so that we avoid the unnecessary litigations that we see in the state. But what we see and what we've heard from the minister is contrary to what they are telling us now, because they were telling the public through the media briefing that those doctors should go to the private sector and seek employment. Even suggested that those doctors can go abroad and then come back. Now the thing is, we don't agree with that logic to say, as South Africa, we are in a dire shortage of healthcare workers, but we're suggesting that our doctors must go abroad. Or our doctors, I mean, you've had these emotional rhetorics from politicians who are saying the resources in health are in the private sector. But they themselves are telling these doctors to go in the private sector. They've been telling us that in the private sector is serving about 15% of the population, and the private sector about 85%. Now, how do you then take resources, the very same resources, that actually were paid for by taxpayers, because doctors, when they train, they use taxpayers' money. So you would expect that, there is a forward looking in terms of the planning. So it tells me that, we've got people who are sitting there who have a plan they call it a health workers resources, human resource for health, 2030 strategy. But that strategy is sitting there, and not doing anything. We've got a plan in place, but you are not implementing the plan. So that debate that they are talking about today, I don't honestly believe that is going to sort out this problem. The problem is we must ask and in fact insist that Treasury must bail out the Department of Health. If they can bail out entities that are not really assisting the country like SAA, why can't they save sick human beings in the Department of Health and assist the Department of Health to come out of this problem? So we are insisting even today to say, they come to their senses and employ all those doctors? Because in the public sector now, we've got about 1,500 unfunded posts. That's what we've been told. But no, they are still thinking about it. But on top of that, Polly, that some money in some provinces have been taken back. There was under expenditure by the same Department of Health.
Absolutely spot on. Dr. Mzukwa, let me thank you very much for
So guys, I don't know, man, what are your thoughts on what is happening in South Africa right now, man? Personally, I think what is happening in South Africa, it is shameful, man. It is shameful. It is shameful, man. And we are just suffering the consequences of this inept government. These are the consequences of this corrupt, inept government. Guys, I don't know, man. Please tell me what you think on the comment section. Don't forget to hit that like button. And the most important part, subscribe. My name is Thomas Mabaso. I will see you next time. Bye-bye.